Faster than a cat on a hot tin roof. Divided into perfect bite-sized nibbles, safer, healthier, and infection-free, this is Quick Zips, the late-night edition. Sexuality education fast.
I'm Galena Mines, and welcome to our show. You have questions, we have answers. Many of your questions are about STI symptoms. Symptoms are things that happen to your body that may indicate an infection or disease. The question of the day: how can I tell if I have an STI? The short answer is that you cannot tell by yourself for sure whether you have a sexually transmitted infection. Some people may feel different or experience physical changes in their bodies that make them think they may have an STI, but many times you cannot tell by looking or even by how you feel. That's because many people won't have any symptoms at all. They feel fine and don't notice any physical changes. Yet, even without symptoms, they have infections that can cause long-term health problems. And these infections can be passed to others. And let's face it, giving someone else a sexually transmitted infection is not a good way to make friends, and definitely doesn't leave a good first impression. So, it is very important if you are sexually active to practice safer sex by having only one sexual partner, getting tested by a doctor in order to be sure you are infection-free, and always correctly using a condom for all sexual activity. That said, there are some fairly common STI symptoms, and they fall into a few exciting and not-so-fun categories. Burning during urination. You pee, it hurts, get it checked out. Itching around the genitals. This could mean crabs or simply a rash. Only a doctor can tell you for sure. Drips. A thick discharge from the penis or vagina might look like pus, sometimes yellowish or milky white. Definitely not good. See a doctor. Bumps and sores on the genitals or around the mouth or anus. These can be painful or painless. They can look like pimples or a small wound. They can have pus in them or be clear. Go to a doctor. Stomach pain, rash, fever, feeling achy all over. There are a lot of other symptoms that can mean you have an infection. Get thee to a healthcare provider. And remember, many people have no symptoms at all, which is called being asymptomatic. Frequently, people get symptoms and then the symptoms go away on their own. This does not mean they are cured. If you have symptoms and they go away, you are probably still infected. You need to go to the doctor for treatment. STIs do not go away on their own. Some of the symptoms may go away, but you are still infected with an STI. And the longer you wait, the worse they can get. That means you can have lifelong problems. Other illnesses that are not sexually transmitted may have similar symptoms. That's why it's important to see a doctor. The doctor can tell if you have an STI or something else. If you have an STI, the doctor will help you treat or cure it. That's it for this segment of Quick Zips, the late night edition. Remember, not everyone shows symptoms of infection, and because of this, not everyone knows they are infected. However, if you have drips, sores, pus, or painful urination, it's a big hint. If you are sexually active or have one of these symptoms, see a doc. Know for sure. Be safe. See you next time.
This episode of Quick Zips is brought to you by the Guy Condo Bad Guys, who would like to remind you that even if you don't have any symptoms, or if you had some and they went away, that doesn't mean you don't have an infection. Just see a doctor.